So first of all, we are having Dr. Abdullah Masud and his talk title is Nano-Targeting in Advancing Heart Attack Treatment.
Awesome. Yeah, I hope all of you guys are doing all right. And can I ask you guys to take a deep breath, because I'll be talking about heart attack. Anyway, sadly, 1 million people in the US get heart attack every year. And we all know that people having heart attack get severe chest pain. And unfortunately, there is no effective therapeutic medication so far to manage this pain or inflammation. And that's why my research is mostly focused on relieving this pain. Now, let's take a look what actually happened in the case of heart attack. You can see a heart here, and it has a special type of blood vessel. We call it coronary artery, and which basically supplies blood to the heart muscle. Now, if this coronary artery get blocked due to fat deposition, what will happen? These heart muscles will get weak, right? Due to lack of blood supply, lack of oxygen supply, that means lack of nutrition supply, right? And that means there's an injury in the heart muscle. Irrespective of any kind of injury you get in our body, our first line of response actually comes from our own protective system. We call it actually immune cell. And you can see that one of the immune cell is called macrophages, play a very crucial and interesting role in this pain management. So whenever this injury happens, so what happens is that this pro-inflammatory macrophages comes in, and as their name indicates, they induce inflammation. That's why whenever you get any kind of injury in your body, in first few days, the pain is too much, right? Because of this bad guy. But what happens after that? After some days, it goes down, right? Because of what? Because there is a good guy. It's called anti-inflammatory macrophages, and these anti-inflammatory macrophages comes in later, and they, as their name indicates, they relieve pain. Now, if I ask you a question that what should we do to accelerate this pain management? And I'm definitely sure you will agree with me that we need to find a way so that we can transform this bad guy to the good guy, right? Yeah, that's what I'm doing in my research. So we find a molecule like erythromycin can do so. But the problem is this drug itself has a toxic effect. To mask this toxic effect, what we did, we put this drug in a nanoparticle, and we actually really get a good results that you can see here. So what we did here is that we gave heart attack to the mice and then treated them with free drug and drug in nanoparticle. And we found that, and you can see here that with the free drug, the survival is only 25%. But when we treated them with drug in nanoparticle, the survival rate is now 75%, almost 50% improvement in the survival. That's good, right? But not great yet, because we want it to be 100%. That's what actually we're working on. And until then, take care of your heart. Thanks everyone for listening.